Imagine a future where medical diagnoses are, well, not just faster, but incredibly accurate, where discovering new drugs has totally revolutionized think years down to days, and where your healthcare journey is genuinely personalized, like built completely around your unique needs. This isn't science fiction anymore. It's the future that's rapidly unfolding right now with generative AI in healthcare. Today, we're doing a deep dive into generative AI, Gen AI. You'll hear it called specifically in the healthcare sector. Our mission really is to unpack how this transformative tech is reshaping, well, everything, from direct patient care to medical research and even the operational side of things. We'll look at the huge potential, the really exciting trends we see emerging for 2025, and importantly, the critical challenges we absolutely have to navigate for ethical and equitable deployment. We're drawing our insights today from some really solid analyses. Think leading organizations like John Snow Labs, the Brookings Institution, and McKinsey. Stick with us, and by the end of this, you'll have a clear grasp of this groundbreaking subject. Okay, let's unpack this then. What exactly is generative AI in healthcare, and why is everyone talking about it right now?
Right. Well, generative AI is genuinely a transformative technology. It uses these advanced algorithms to synthesize and analyze just vast amounts of medical data. But its unique power, the thing that sets it apart, is its ability to actually create new content or generate totally novel insights. Essentially, it's taking processes that used to be incredibly time-consuming, very manual, and making them profoundly efficient and innovative, too.
That core capability, the creation part, that's what makes it so exciting, I think. Let's pivot maybe to some tangible examples, because this isn't just theory, is it? Where are we actually seeing this power making a real difference today in healthcare?
Absolutely. Yeah, a really immediate impact is in just streamlining information. Our sources, McKinsey included, highlight how GenAI is brilliant at summarizing massive amounts of data. Think patient histories. Imagine it rapidly sifting through years of medical notes, lab results, summaries. This frees up healthcare professionals, lets them focus their valuable time on more complex patient needs, on that direct interaction.
Okay, that immediate efficiency boost is really clear. But beyond just summarizing what's already there, what about creating something genuinely new? Like you hear a lot about drug discovery.
Ah, yes. This is where GenAI truly changes the paradigm. It massively expedites identifying new drug compounds. It does this by simulating their interactions with biological targets. So instead of lengthy, super expensive lab trials for every single potential molecule, GenAI can digitally predict the likely safety and efficacy of new drugs. It significantly cuts down the time, the costs of that conventional development process. For instance, Atomwise, which is cited in our research, uses AI to predict how molecules will behave. This speeds up finding potential drug candidates for diseases like, say, Ebola or multiple sclerosis. We're talking about shortening the drug development life cycle from years, potentially down to days, or even hours in some cases. It's fundamentally shifting things.
Wow, years to days or hours. That acceleration potential is just, well, staggering. And it's not just about drugs.
Right.
How's it impacting actual diagnosis?
Yeah, it's also enhancing the accuracy and efficiency when interpreting medical data. This leads to much more precise diagnoses, particularly for common conditions where there's a lot of data available. For example, there was a really notable study published in Nature back in 2020. It found AI algorithms actually outperformed human radiologists in detecting diseases like breast cancer from mammograms.
That's a pretty significant finding.
Yeah.
So this isn't really about AI replacing doctors or radiologists. It's more like augmenting their skills.
Precisely. That's the key takeaway. Imagine clinicians having this tireless, super attentive second pair of eyes, something that can catch microscopic anomalies, maybe freeing them up to focus on the nuanced patient conversation, the complex decisions. That's the real shift. AI as a powerful co-pilot, you could say, not a replacement. And this precision, it extends right into personalized patient care. Gen AI analyzes these vast data sets, genomics, lifestyle factors, ongoing health info to create truly customized care plans just for you. This tailored approach, well, it enhances treatment efficacy, minimizes adverse reactions, and ultimately improves patient outcomes and satisfaction.
And I gather medical imaging is another area seeing major transformation. AI is actually helping refine the images themselves.
That's right. AI algorithms can enhance the image signal-to-noise ratio. Think of it like cleaning up static on a radio signal. Makes the picture much clearer. And they can perform reconstruction to improve spatial resolution, meaning it can pick out much finer details in the scans. It can even generate high-quality synthetic images. These are useful for training or diagnosis, creating realistic images from partial or incomplete data. And this synthetic approach also helps protect patient privacy, maybe by blurring identifiable information.
Okay, and that idea of synthetic data you just mentioned, generating data that looks real but isn't tied to a real person, that sounds revolutionary for research, especially with privacy concerns.
It absolutely is. Gene AI is excellent for generating this synthetic data that really mimics real patient data. This is incredibly valuable for areas like pediatric research or for rare diseases where real patient data is just scarce. It allows researchers to effectively mimic clinical trials, test theories, without the ethical hurdles and security risks of using actual patient data. This accelerates research, helps develop new treatments and therapies. You get results in days or hours that might traditionally take years.
Right, we've touched on research diagnostics, but how is Gen AI interacting directly with patients? Are things like medical chatbots becoming more common?
They are, yes. And it's a really crucial point for accessibility. These AI-powered tools can offer 24/7 communication. They can answer patient queries, help schedule appointments, monitor symptoms remotely, even guide patients through their healthcare journey. They genuinely improve access to care and help optimize scarce healthcare resources. There are even studies showing that patients are sometimes more willing to engage with, say, robotic therapists for sensitive issues, things like substance abuse or mental health concerns, perhaps due to a perceived lack of judgment.
Interesting. And for the healthcare professionals themselves, beyond diagnosis support, how is Gen AI helping with their training?
Medical simulations based on Gen AI are proving invaluable here. They allow doctors, nurses, other professionals to practice procedures or maybe handle low-frequency clinical scenarios, all in a completely risk-free environment. This naturally leads to better patient care down the line and faster learning for the professionals. And these simulations are becoming incredibly realistic because they can use real, anonymized patient data to design really diverse and challenging patient cases.
So it's really impacting the whole system, from patient interaction to professional development. And behind the scenes, too, improving healthcare operations.
It is, absolutely. Gen AI can, for example, forecast patient flow rates in hospitals. That helps with staffing. It can assist hospitals in scheduling personnel more efficiently, identify bottlenecks in how care is delivered. This significantly boosts efficiency, can decrease those frustrating patient wait times, and ultimately lower operational costs. McKinsey's survey actually showed that healthcare leaders see big opportunities here, particularly in administrative efficiency and boosting clinical productivity. And then if you look even broader at population health, by leveraging huge data sets from electronic health records, from health information exchanges, Gen AI can identify patients who are at risk for certain conditions, and then help formulate customized care plans to maybe prevent serious health events before they happen.
These applications are genuinely impressive. It feels like it's touching almost every part of healthcare. But looking ahead now, what are the experts predicting? What are the next big shifts for Gen AI in healthcare, say, as we head into 2025?
Right, connecting this to the bigger picture. 2025 isn't just about, early adoption and pilot projects anymore. It looks set for much more widespread implementation and more advanced integration. One key trend that John Snow Labs highlights is a greater adoption of multimodal AI models. In 2024, a lot of applications were primarily text-based, but 2025 is likely to see a big shift towards models that can analyze and generate text, images, genomics data, even real-time patient vitals all simultaneously. Imagine an AI that can process your entire medical record, x-rays, blood tests, genetic profile, live heart rate all at once, giving this incredibly comprehensive picture. This will dramatically improve diagnostics and clinical decision support.
Wow, that multimodal approach sounds like a huge leap for getting a complete patient view. But with such powerful tools becoming widespread, what about the guardrails? The ethical and regulatory side must be racing to keep up.
That's an excellent point, and it leads straight into another major trend predicted for 2025: enhanced regulation and ethical AI governance. The focus will really be on refining those regulatory frameworks, ensuring transparency, mitigating bias, guaranteeing data security, especially in crucial areas like clinical trials and drug development, where that synthetic data generation we talked about plays such a pivotal role. And this ties right into the expansion of using generative AI for synthetic data itself. It's set to become an even more critical tool for research and AI model training. It lets researchers create these realistic yet anonymous data sets to speed up finding new treatments without compromising patient confidentiality.
Okay, so regulation and synthetic data are evolving together. What other key advancements are shaping Gen AI in healthcare for 2025?
Well, personalized and AI-powered drug discovery will keep advancing. We'll see Gene AI designing novel drug compounds practically in real time. Things like AI-driven protein structure predictions and molecule generation will continue to shorten that drug development lifecycle. And finally, we expect AI-augmented precision medicine and diagnostics to become even more refined. AI models analyzing genetic, lifestyle, environmental factors, providing hyper-personalized treatment recommendations with really unprecedented accuracy, making precision medicine more effective than ever before.
It certainly sounds like a future brimming with potential multimodal, regulated, hyper-personalized. But let's be realistic. Every major tech shift hits bumps in the road. What are the hurdles, the challenges we need to overcome for this widespread adoption in healthcare?
Yeah, that's a critical question. Because while the benefits are remarkable, deploying Gen AI in healthcare definitely comes with significant challenges, things we need to address very carefully. One major hurdle is interpretability and transparency. People often talk about the black box nature of AI. Especially with deep learning algorithms, it can be really difficult for healthcare professionals to understand exactly how a decision or recommendation was made, and that lack of transparency, it can seriously hinder trust. Our sources, John Snow Labs included, mention that many organizations are actively working on solutions that prioritize explainability, making sure doctors can understand the AI's reasoning.
Right, the black box problem. And you mentioned data earlier.
Yeah.
With so much sensitive patient information involved, privacy and security must be massive concerns.
Oh, absolutely critical. Data privacy and security are paramount. The need for these huge data sets for training just raises significant concerns about handling sensitive healthcare data. Strict compliance with regulations like IPA is non-negotiable. Our sources indicate many platforms are being built with privacy by design principles, using robust encryption and anonymization techniques from the start. This also connects directly to another big challenge: bias and fairness. AI models can unfortunately learn and even amplify biases present in their training data. This could lead to unfair or biased decisions in patient care. So many industry players are focusing on building diverse data sets and providing tools specifically for bias detection and mitigation.
So it's not just about building the tech, but building it responsibly from the ground up.
Yeah.
What about the practical side for hospitals and clinics trying to actually use this stuff?
Good point. Scalability and integration are major practical challenges. Healthcare enterprises often struggle with scaling AI solutions across different departments, different hospitals, and integrating them smoothly with their existing, often quite old, IT infrastructure. Organizations are trying to develop scalable platforms and integration services designed specifically to work with current systems. Then there's the critical need for expertise. Successful deployment really requires this rare blend of deep domain expertise, understanding healthcare, and advanced AI technology skills. Many firms are trying to bridge this gap, offering expert consulting or putting together teams that combine both skill sets.
Okay, so technical and expertise gaps.
Hmm.
Are there even deeper, maybe systemic issues at play too?
There are, unfortunately. Accountability and liability are huge questions. Ultimately, healthcare providers bear the responsibility for patient treatments. Altering the existing legal frameworks to somehow shift that treatment responsibility onto AI developers, that seems highly improbable. It poses too great a risk. And this uncertainty also impacts patient trust and acceptance. We're just not yet at a level where widespread implementation of AI-managed treatments would be fully trusted by the public. We also face limitations with the data itself. The effectiveness of AI really hinges on having substantial, diverse data sets. But often, these data sets lack crucial information that goes beyond traditional electronic health records, things like a patient's social determinants of health or their lifestyle choices. And there's a critical policy concern, which the Brookings Institution really highlighted: the risk of data monopolies. Larger medical providers, those with huge market share, naturally have more data. This could strengthen their positions, potentially even increasing healthcare costs and disadvantaging smaller, independent providers who just don't have that scale of data.
Okay, wow. So we've laid out the immense promise, but also some really critical pitfalls of the black box, privacy, bias, liability, data monopolies. How then do healthcare organizations, policymakers, navigate this incredibly complex but clearly crucial landscape to make sure Gen AI actually benefits everyone fairly?
It's fascinating, actually, seeing how different stakeholders are tackling deployment and governance. There's a real emphasis on strategic planning, robust integration, and, as you said, crucial policy considerations. For enterprises, the starting point has to be strategic planning and investment. You need a clear plan from the outset, identify the specific healthcare challenges you want Gen AI to address, maybe improving diagnosis accuracy, maybe personalizing care pathways, and then invest in the right technology infrastructure and the right AI models for that job.
Right, so have a clear goal.
Yeah.
And once you have the plan and the tech, it's all about making it work smoothly within the existing hospital or clinic environment.
Precisely. Successful integration is absolutely key. Gen AI has to be seamlessly woven into existing healthcare systems, existing workflows, and crucially, this has to go hand in hand with training healthcare professionals so they can effectively use these powerful new tools. McKinsey's survey actually found that 85% of healthcare leaders are already exploring or actively implementing Gen AI. So this integration challenge is clearly top of mind. Also, leveraging big data effectively is essential. The real power of Gen AI comes from analyzing these vast volumes of data from EHRs, imaging, genomics. Ensuring the quality and accessibility of that data is fundamental for building effective AI models. McKinsey also noted something interesting. 46% of the leaders they surveyed who were exploring partnerships were specifically looking to hyperscalers, the big cloud providers, for their data management expertise.
Okay, that makes sense. Tapping into external expertise for the heavy lifting on data. So it sounds like partnerships are a big part of the strategy.
Indeed. Scaling these Gen AI solutions effectively requires flexible, scalable tech infrastructure. It needs continuous performance monitoring, iterative improvements based on real-world feedback. And yes, partnerships seem to be the dominant strategy right now. McKinsey's latest survey from Q4 2024 found that 61% of healthcare leaders intend to pursue partnerships with third-party vendors to get customized Gen AI solutions.
That figure, 61%, really underscores how complex this is. Organizations aren't trying to build it all themselves. What about the bigger picture then? The policy recommendations needed to guide all this activity, especially addressing those concerns around trust and preventing data monopolies.
Yeah, the Brookings Institution offers some really important policy recommendations here. First and foremost, transparency. They argue it's paramount to foster a climate of transparency among AI developers and also to facilitate really synergistic collaboration between healthcare professionals and the tech experts. This helps ensure AI recommendations are medically sound and that they're meticulously scrutinized for accuracy by human experts.
Okay, transparency is key. And for us as patients, what about consent? Especially if data is coming from our wearables, our smart devices.
Absolutely crucial. Informed consent is vital. Patients must be thoroughly informed about how AI is being used in their healthcare journey. They need to understand the privacy implications, especially when data collection extends beyond the clinic to things like wearable devices or smart home tech. Educating patients here is key to building trust. And finally, to tackle that data monopoly issue we discussed, Brookings suggests leveraging health information exchanges, or HIEs. The idea is to mitigate the risk of large providers dominating simply because they have more data. These HIEs could act as aggregators. They could integrate data from lots of different providers, big and small. Then, they could potentially offer AI tools and insights as a shared service back to all their members. This could help level the playing field, ensuring that entities of all sizes can benefit from insights drawn from much larger combined data sets.
That HIE model is an interesting potential solution. So as you can clearly hear, generative AI in healthcare is this unfolding journey. It's got immense potential, but also some really critical considerations we need to keep front of mind. It's really not just about the technology itself. It's about making healthcare fundamentally smarter, faster, and ultimately more effective for you.
Exactly. It's truly about reshaping care, making it more predictive, more preventative, and much more patient-centric. These advancements mean we're looking at greater accuracy in diagnostics, more personalized treatments tailored to individuals, and significantly accelerated medical research.
But the road ahead is definitely complex. It's going to require continuous agility, a real readiness from everyone involved to embrace change. Every stakeholder, from the AI developers building these tools to the healthcare providers using them to the policymakers setting the rules, everyone plays a vital role in shaping a future where Gen AI enhances healthcare in a way that's fair, just, and truly beneficial for all of us. And maybe here's a final thought to leave you with. Consider this. If Gen AI can generate high-quality synthetic data to mimic clinical trials for rare diseases, or even simulate global health crises like pandemics to test theories and foster worldwide research collaboration without the usual ethical or privacy risks, what entirely new frontiers of medical understanding might we be able to unlock? Could we potentially preemptively address health challenges that today we can barely even imagine?